Growing cancer burden in the country, nominated Senator Getrude Musuruve has called for improved coordination between the national and county government to fight the disease. Musuruve said it was time the government consider subsidizing the cost of cancer screening to enable Kenyans to go for such services.
I want to urge the national government and the county government to ensure that even in the county governments, these services of testing are available, and not only available, they should be completely free, so that people can go anytime for a cancer test at no cost. And also they need to have capacity building at county level to ensure that these services are reaching wananchi.
Speaking while paying tribute to the late Kibra Member of Parliament Ken Okoth, the senator called on Kenyans to ensure they undergo cancer screening as the disease can be prevented or managed in its early stages.
I want to encourage Kenyans to really go for early tests, and when they go for early tests and it's detected, then they can go for treatment also early enough. Because as Kenyans, we need to see how to ensure that we are not continuing to lose many deaths as a result of cancer.
The nominated senator also called on the government to consider helping cancer survivors in the society as the disease is financially draining.
NHIF needs to also come in and see how it is going to support Kenyans, especially those who have been diagnosed with cancer, because they need to go for treatment. So there's need for even more coverage for people suffering, from cancer, so that anytime they want to go for cycles of treatment, especially those who come from poor backgrounds, the common wananchi, they should get these services free. When it comes to the cycle, they should be completely free.
Meanwhile, Health Cabinet Secretary Cecily Kariuki has raised concern over the rising cases of homicides and suicide in the country. The CSOs in Nyandarua said studies have shown that the trend can be attributed to high levels of drug and substance abuse and lack of candid communication among families.
The 2,000 bars licensed today are a contributor directly, and I want to say that loudly. They are a contributor directly to matters of mental health, because suicide is a result of mental health condition. It is for this reason, therefore, I take note that at the national level, we are about to complete a framework of interventions for mental health in this country.
The CS said non-communicable diseases such as diabetes, cancer and hypertension can be managed if those affected are screened early.
Guidelines will be shared with you, the teams in the administration, so that you are also able to speak to these very common sense issues.
Reporting for Channel 1 News, I'm Jackie Wambiro.